In medicine, confusion costs marks and mistakes cost lives. Stop memorizing, start understanding. This is Dr. ABM, where medicine finally makes sense. Have you ever wondered how your upper limb is capable of such wide range of movements? From lifting, to throwing, to writing, to gripping. In this video, we are going to simplify the joints of the upper limb, and we're going to look at their types, the articular surfaces, ligaments, blood supply, nerve supply, and movement. And by the end of this tutorial, these joints will become much easier to understand and remember for your anatomy exam. So let's get right in. Now, the first joint we'll start with is the acromioclavicular joint, like you can see on the screen. So this is the acromioclavicular joint. It is a plain type of synovial joint and is located between the lateral end of the clavicle and the acromion of the scapula. So this is the acromion of scapula and this is the lateral end of the clavicle, right? It is made up of fibrocartilage and allows a degree of axial rotation. Now, no muscle acts directly on the joint. All the movement is passive and is initiated by movement at other joints. Very, very important. Now, moving on, we'll go to the muscles. We'll go to the joints. Moving on, sternoclavicular joint. The sternoclavicular joint is a saddle joint. It is formed by articulation between the sternal end of the clavicle and the manubrium of the sternum. So this is the sternal end of the clavicle and the manubrium of the sternum. They articulate at this position, and the first part, the first costal cartilage, you have it here. Now the articular surfaces are covered with fibrocartilage. Now the joint is separated into two compartments by fibrocartilaginous articular disc. The movements of the joint include elevation of the shoulder, depression of the shoulders, protraction of the shoulders, retraction, and rotation. Moving on, we'll talk about the shoulder joint. Now the shoulder joint is also called the glenohumeral joint. The shoulder joint is a synovial joint, a ball and socket type of synovial joint. This means it moves in multiple directions and it has a remarkable mobility. Now the articular surfaces that you have are the glenoid cavity of the scapula and the head of the humerus. So the head of the humerus articulates with the glenoid cavity of the scapula. Now the ligaments that surround or that supports this joint include the capsular ligament, the coracohumeral ligament, the coracoacromial ligament, and the glenoid labrum. Now the glenoid labrum deepens the glenoid cavity and improves joint stability. The blood supply is from the anterior and posterior circumflex humeral artery, the suprascapular artery, and the subscapular vessels. Very, very important. The nerve supply is by the axillary nerve, which is the most important, and then the musculocutaneous nerve and the suprascapular nerve. The movement of the joints include flexion, which is majorly by the pectoralis major muscle, the deltoid muscle, then extension, which is done by the posterior fibers of the deltoid and the latissimus dorsi muscle. Then we have adduction. Adduction is done by moving the arm closer to the body, and is done by the pectoralis major and the latissimus dorsi, then the short head of the biceps brachii. Then abduction is by the serratus anterior and the serratus and the trapezius. That is the shoulder joint. Moving on, we'll go to the elbow joint. Now, the elbow joint is also a synovial joint, but it's a hinge type of synovial joint. Now, the articulating surfaces include the capitulum of the humerus, the head of the radius, then the trochlea of the humerus, and the trochlear notch of the ulna. You can see it anteriorly, and this is the posterior view. Now the ligaments surrounding this joint are the capsular ligament, the ulnar collateral ligament, and the radial collateral ligament. The blood supply is from the anastomosis, the cubital anastomosis around the elbow, which is formed by the recurrent branches and collateral branches of the brachial arteries. The nerve supply is by the ulnar nerve, the radial nerve, the median, and the musculocutaneous. Now the elbow joint does flexion, which is performed by the brachialis, bicep brachialis, and the brachioradialis muscle. Then extension by the triceps brachii and the acromioclavicular. Moving on, we'll talk about the radioulnar joints. Moving on, we'll talk about the radioulnar joint. So the radioulnar joints are two. There's the proximal radioulnar and the distal radioulnar. And then there are a middle radioulnar, which is called the interosseous. So these joints are responsible for pronation and supination. Now we'll start with the proximal radioulnar joint. So this is the proximal radioulnar joint. The articular surfaces are the head of the humerus, the head of the radius, and the radial notch of the ulnar. Please take note, head of radius and the radial notch of the ulnar. Right, so this is the head of the radius and the notch, the radial notch of the ulnar. Right, the ligaments here are the annular ligament and the quadrate ligament. The blood supply is from the cubital anastomosis, from the elbow. The nerve supply here is musculocutaneous nerve, median nerve, and radial nerve. Then for the distal radioulnar joint, which you can see here, is a pivot synovial joint. The articular surfaces are the head of the ulnar and the ulnar notch of the radius. So you have it here. This is the radius, this is the ulnar, right? The ligament is the anterior and posterior ligament, and then the articular disc. Blood supply is by the anterior and posterior interosseous artery. Nerve supply is also anterior and posterior interosseous nerves. So the arteries and the nerves share the same names. Now the radioulnar joint do pronation and supination. Pronation is done by the pronator quadratus and the pronator teres muscles, while supination is done by the supinator muscle and the biceps brachii, which play a role. Moving on, we'll talk about the wrist joints. Moving on, we'll talk about the wrist joint, also known as the radiocarpal joint. It's an ellipsoid type of synovial joint. The articular surfaces are the radius, the lower end of the radius, and the disc, the articular disc of the radioulnar joint, and then the carpal bones. The carpal bones that are involved are the proximal carpal bones, which are the scaphoid, lunate, tricrutrium. These three: scaphoid, lunate, tricrutrium. Now the ligaments that support it are the articular capsule ligament, the palmar carpal ligament, dorsal radiocarpal ligament, radial collateral ligament, ulnar collateral ligament. The blood supply is from the anterior carpal and the posterior carpal arch, or the carpal arch, and the nerve supply is by the anterior and posterior interosseous nerve. The wrist does flexion by the flexor muscles, like flexor carpi radialis, flexor carpi ulnaris, extension by the extensor muscles, extensor carpi radialis longus, and all the other extensor muscles. Then it also does abduction and adduction. So what we have said so far: shoulder joint is a ball and socket type of joint. Elbow joint is an hinge type. Radioulnar joints are pivot. Wrist joints are ellipsoid joints. Now, we'll talk about the other hand joints. Moving on, we'll talk about some joints in the hand, which include the carpometacarpal joint. The carpometacarpal joint is formed between the carpal bones and the metacarpal bones. This joint is located at the bottom of the hand bone, right? So this is where you have the carpometacarpal joint, the CMC joint, and it's a saddle type of joint, a saddle joint. Then we have the MCP joint, metacarpophalangeal joint. The metacarpophalangeal joints are joined between the metacarpal bones and the phalanges. So this is the MCP joint. They form your knuckles. So these are the metacarpals and these are the phalanges. So metacarpophalangeal, metacarpophalangeal. Right? The MCP joint is where the hand bone meets the finger bone, and that's why you call them the knuckle. These joints are very important as they allow us to bend, flex, and spread our fingers. It's a condyloid joint. Then we have the interphalangeal joint, which are divided into two: the proximal interphalangeal joint and the distal interphalangeal joint. The proximal interphalangeal joint is the joint, is the first one just before the distal. It's located below the top two bones of the finger and allows the finger to bend and extend. So this is the proximal, between the first and second phalanges, first and second proximal, right? And then the distal interphalangeal joint is located at the tip of the finger, just before the fingernail. So this is the distal. It's important you know that on the thumb you only have one interphalangeal joint because they possess two phalanges. Very important. All right. Again, we go over what we have said as a way of summarizing. We started by saying that the joints of the upper limb include the acromioclavicular joint, then the sternoclavicular joint, then the shoulder joint, then the elbow joint, the radioulnar joint, the wrist joint, and the hand joint. And so that's it for the joint of the upper limb. If this video helped simplify upper limb anatomy for you, make sure you continue revising this movement, ligaments, and nerve supplies because they are extremely high yield for your anatomy exams. Now that's how this concept should be understood: clear, precise, and exam ready. If this helped you, go ahead, like the video, drop a comment, and tell me what topic you want next. This is Dr. ABM, where you don't just study medicine, you master it.